Today we're going to talk a little bit about dental and oral health. So we're not going to talk about, do we need to brush our teeth? Do we need to floss? You should already be doing that stuff. And if you're not, well, then this video is really not for you. We're going to talk a little bit more about some nutritional deficiencies that can also be causing some of those issues after we've already addressed our oral health through brushing, flossing. The first thing we're going to talk about is bad breath. Okay, we're going to talk about bad breath. We're going to talk about bone and tooth loss. And the third thing we're talking about is gum loss. So the first thing, bad breath. We're going to assume we are flossing and we are brushing our teeth regularly. That's going to be your primary attack for that. After that, bad breath can really start coming from poor digestion in the stomach. It's called halitosis. And some of that can be coming from the poor digestion down there in the stomach, and there's bacteria that are giving off gases, and those gases are coming up and coming out as bad breath. A couple things we want to focus on here are eating a quality whole food diet. After that, we're going to look at the acid content in the stomach. Now, when we have low acid, which is the most common issue in the stomach, even though most people will tell you that it is, you have too much acid and that's what causes reflux. Anyway, whole nother topic for a whole nother day. When we have low acid, these bacteria can replicate in a more alkaline environment, and that can cause that. So what we'll use is a product called Zypan. It's got a couple enzymes that act in the stomach, as well as some ingredients that are precursors for stomach acid. So once they get down into the stomach, they turn into stomach acid. Increases the digestion of food and decreases those bad bacteria. Therefore, the bad breath can go away. This can also help with bloating and several other things. It's a really great product. The next thing we're going to talk about is bone loss in teeth. The first thing we want to look at here is our diet. We want to get rid of our low-hanging fruit, which is going to be your simple sugars, which feed the bad bacteria in your mouth. That can be in foods and drinks, candies. We want to make sure we're also hydrated. Hydration makes sure that helps with the pH in the mouth, which can affect the bone loss through the teeth, as well as making sure our immune system can help keep the gut flora in balance and keep those bad bacteria out of there. We're also going to look at some products that specifically give us the minerals that the body needs to support those bones. We use Bios and we use Biodent. They have some whole food sources of calcium, bone, phosphorus, all these different nutrients that the body needs to support those bones, which is what your teeth are, and the enamel, that type of thing on your teeth. The next thing we're going to move on to is bleeding gums, receding gum lines. If you're not flossing, you're smoking, that type of thing, this video isn't for you because you need to go do that before we even get to this point. We're going to talk about vitamins A, vitamin C, and then what's called rutin. Vitamin A is great for the immune system. It's great for just tissue health in general. Vitamin C, specifically the whole food vitamin C, not just your ascorbic acid, the whole food complex. This is great for building collagen, and which your gums are a form of collagen. That's really good for supporting the immune system in the mouth, but also help rebuild that collagen, the gum tissue itself. And finally, the rutin, factor P. It really helps with the integrity of the blood vessels. When our blood vessels integrity are going down, it's going to bleed more. When we bleed more, and those small capillaries in the gums become more fragile, they're not going to be able to support the gum tissue as well. So we want to support that, make sure those capillaries are strong and getting the blood flow to those tissues. That'll help it fight any bacteria that are in there and therefore support a healthy gum tissue. These are the things that really you can do to support your mouth, support your teeth, your bones in your mouth, and your gums. Those products right there, they're great. You got the Zypan for digestion as well as the bad breath. You got the Bios and the Biodent to help with the density of the bone, and then you have that Cataplex ACP, which has got the vitamin A, the vitamin C, and then the P is the rutin. Those are all the great products for that. On top of that, you really need to be making sure that your diet is supporting that. We need to have low sugar, good hydration. If you are going to eat something sugary, make sure you get some good water. Drinking water can help rinse some of that sugar out and decrease the acidity as well by buffering it with the water. The health in your mouth can translate to the rest of your body. So you really want to take care of it. One other tip that you can do for your oral health, there's something called oil pulling. Oil pulling is when you take coconut oil or even some sesame oil. I prefer coconut oil. You put some in your mouth, maybe a tablespoon or whatnot, and you swish it around in your mouth for 10 to 15 minutes, and then you spit it out in a trash can. You don't want to spit it down the sink, it'll clog your drains. And what that does is it helps, coconut oil can be antibacterial, it helps with promoting the proper microbiome in the mouth. So it's a great little tool that you can do. It does take some time, it takes a little getting used to, but it is something that you can do to help with your oral health. So take these tips and improve your oral health and improve your health overall.